It's another day with the physicians where your health is our business. With growth spot the end. So you are not going to take some drastic measures. But a 10-year-old tummy, pressure is high. But also to know that not only when your pressure is high that you have glaucoma.
And I don't know about any other one, but what you know is
You're welcome back to the Planet Author of your regular program.
You putting breast milk in the eye, of course, is wrong. It's a no-no. And this is a common practice in our environment, you know. Maybe from culture, they believe that if a child has redness in the eye, just putting breast milk in the eye would help.
Sleep, like nutrition and physical activity, is a critical determinant of health and well-being. Sleep is a basic requirement for infant, child, and adolescent health and development. Sleep loss and untreated sleep disorders influence basic patterns of behavior that negatively affect family health and interpersonal relationships. Fatigue and sleepiness can reduce productivity and increase the chance for mishaps such as medical errors and motor vehicle or industrial accidents. Our goal today is to increase public knowledge of how adequate sleep and treatment of sleep disorders improve health, productivity, wellness, quality of life, and safety on roads and in the workplace. We have a guest that will deal with this particular topic on sleep health, sleep to live. It's another day with the physicians where your health is our business. It's always a pleasure knowing that you are there waiting to keep a date with your physicians. Your health is always our business. We'll be discussing sleep health and sleep to live. And with me in the studio we have our guest, Dr. Chinasa Amadi. She's a board-certified lifestyle medicine physician and also the founder, ARIELLA Health and Fitness. Doctor, you're welcome to our program.
Thank you so much.
You look really radiant. And I'm sure you had enough sleep before coming.
Thank you so much.
You heard me talk about sleep health and sleep to live. So you want to give us a general overview. What is sleep in the first instance? Because some people, they're sitting over you, they are asleep.
Sleep.
Do we call that one sleep? So what is sleep actually then before you talk about sleep health?
Well, I would say sleep health, they are almost, you know, it's that circle of between unconsciousness and wakefulness. Let me just say it that way so that it's not too complex. Between unconsciousness and wakefulness. And the sleep on its own, it has different phases, physiologically, it has different phases. Now, I'm very particular about one phase of the sleep cycle that a lot of restoration happens, a lot of cellular restoration, a lot of body healing. And sadly, most people do not get up to that phase, which is somewhere around the 4th hour of sleep.
From the time of initiation of sleep?
Initiation of sleep to the 4th hour of sleep. And as an adult, the recommendation is 7 to 9 hours.
7 to 9 hours is required for adults every day.
Every day,
Okay.
yes, for good health. Because, you know, studies have shown the link between sleep and optimum health. The quality of sleep, the duration of sleep, not just the duration, but also the quality of sleep and the health of the individual. So it's important that we know that you're sleeping. It can affect your blood pressure, it can affect your blood sugar, it can affect your mental health, it can affect your social relationships, it can affect even your productivity at work. It's I don't even know how to explain it, but it's that component that we do not prioritize as important, because we have that sleep culture where we think sleep is for the weak. You can't sleep and make money. You can't be using all your life on be sleeping. You know, we associate sleep and.
I totally agree. People hardly prioritize sleep. It's not part of their schedule.
Yes.
Instead, they encroach on the time that is required or meant for sleeping.
Because we think sleep is for the weak. But I always say, if you don't sleep, then you're weak. You don't follow, you know, I'll say don't follow the motivational speakers that will tell you you should not be sleeping, you should be making money. But I say you have to be alive to even spend the money before you use it to treat things that you could have prevented by sleeping.
Okay, so you want to first start, you talk about the different phases of sleep.
Yes.
You want to talk about the different processes?
Well, yeah, it's funny. I don't want to make it sound too physiological or too medical, yes. But it's important to note that, just know that sleep, you have to try to get up to that 4th hour of sleep. Okay. Now, what happens most times is either someone wakes up at the 3rd hour of sleep, interrupts that cycle. They go to either use the loo, come back, and then they pick their phone. Okay. Now, studies have also shown that the light, the rays from the phone, from the TV, from the laptop, they inhibit a particular hormone that is called melatonin, the sleep hormone. They inhibit the production of that hormone, so it also reduces your sleep quality, impairs your sleep quality. So when you go to use the loo, come back, you pick your phone to check who liked your post, who commented on that group, and then just reply 1 and 2. By the time you go back to, you're almost trying to start a whole new cycle. And you've already affected, you've already depreciated the hormone level. So your sleep quality you're getting is not optimum anymore. So you wake up feeling not rested. You wake up feeling like you just closed your eye and opened it. And then you're irritable, you're literally cranky, you can be having a headache. If you check your blood pressure at that time, it may even be raised, and we're also saying that the way you sleep affects even your blood sugar.
The way one sleeps affects the blood sugar.
The quality of your sleep, yes. So it's important that at least try to get up to that 4th hour. Okay. Then try to push at least for 6 hours.
Oh, you're saying as if it's magical.
Okay, let's look at it.
When you sleep, you want to know when you wake up. It's not programmed. You are not programmed to wake up after the 4th hour.
Yes.
So because you're saying try to push as if it is one.
Because the truth is that some people think that, whatever time I wake up at 4 a.m., no matter when I sleep. I've had some clients tell me that. And no matter what time I sleep, yes, their bodies. I say if you wake up at that, close your eye and just lie down back. That's what I always say. You understand? So most of us, we have programmed our bodies to not take in adequate amount of sleep. So you're not sleeping early, but your body is conditioned to wake up at 4:30 a.m. Especially, for example, if you stay in a city like Lagos. You're almost conditioned, I need to hit the road. So that is why if you can get in... Now, let's look at it realistically. If you go to bed at 10 o'clock and you wake up at 4 o'clock, you've gotten 6 hours. Yeah. If you go to bed at 11 o'clock, 11 p.m. And you wake up at 5 a.m., you've gotten 6 hours. So can you try to push for that 6 hours? Just to at least get some benefit.
Okay, doctor, I think we should be a bit realistic here.
Okay.
For instance, using Lagos as the base. You close from work like 4 p.m., 5. Traffic, a lot of things. And you don't get home till like 9 or 10. Before you have your late dinner, which is actually wrong.
Yeah.
Then we know we have lots of generators, lights all over the place.
Yeah.
And the noise, in fact, you won't be able to sleep until like 12, 1.
Yeah.
For people that have the challenge of not having that adequate number of sleep, hours of sleep, what are the consequences that are likely to come? Then the benefits of sleeping, having adequate hours of sleep.
One very glaring, I'm sure everybody knows that, is the impact on your blood pressure. And right now we're having a hypertension epidemic that nobody is talking about. You know, there is like literally over the last hypertension day, there was an estimated over 80 million Nigerians are hypertensive. And of course, you know that statistics is just the minimum, literally, because there are a lot that are not. It's a lot higher than that. It was 1 in 3
Most
people.
Most is reduced. Now, it used to be 120 over 80, but I think it's come down now to like 110, 70.
Yeah, well, but even I will say if you can even get at a 120, 80, please. That is, let's try to
manage.
Let's stay there. But that first of all is glaring. You know, you say it's not about anymore just, oh, my mother was not hypertensive, my father was not hypertensive. Now, environment is playing a very heavy role on the onset of hypertension. Environment is also playing heavy role on the onset of even type 2 diabetes. So on even mental disorders, people are having anxiety disorders, people are having depression disorders, but people, you know, depressive disorder, but they're not even talking about it because it's not something that is talked about in our environment.
It's a norm right now, so people are just accepting
it. But these are actually conditions that getting in adequate number of sleep can contribute to, you know, abating, of course, together with other components of the healthy lifestyle. Other components of the health, like what you eat, your exercise, sleep, stress management, social connectedness, you know, avoidance of substance use. Those two all together. So sleep is an integral part of the healthy living spectrum.
Sleep is an integral part of the healthy living spectrum.
Yes,
so maybe you want to tell us some of the advantages.
Now,
although we want to start with the disadvantage. If you don't sleep early, if you don't have that adequate number of
if you don't have enough sleep, you have the risk of, first of all, aside from, you can increase weight gain, especially for the female folk around the midsection, even for the male folk around the midsection. You know, also there's a poor quality productivity at work. So you think you're actually getting in a lot of work, but your productivity is suboptimal. And it also affects, you know, we've talked about mental health. Yes, the mental health. It affects your social relationship with others. Poor sleep affects that.
Poor sleep affects social relationship with others.
Yes.
Just hold it there. When we come back, you probably have to explain how it affects social relationship with others. Everyone gets very agitated, okay? So I'm sure it's getting really interesting. We want to keep it there with the physicians out there. Let's hear what you have to say about sleep. How often, how many hours do you think is expected? Is the right one? How many hours do you think is adequate? How about you? Do you usually wake up at night to use the restroom, come back and pick your phone to check the likes, the number, the followers, or respond to messages? Do you know it actually has impacts if you do that? We'll be back after this short break. Stay tuned.
It's always good to have enough time to sleep, give enough time for the cells of the body to be able to rejuvenate, be able to recover from the stress of the previous day, and be able to prepare you for the next day.
I think a sleep that will take you 8 hours, probably after the day's job, you engage in an 8-hour sleep.
When you sleep at the right time or you sleep for the right hour.
Say about 6 hours, say about 7 hours, it all depends.
I normally sleep by 10. I wake up by 4 a.m.
As long as how many hours I got the time to sleep.
If you've got work that you're doing, if you've got things that are bothering you, that won't let you sleep, if you've got problems you need to solve.
Some people, before they get home from work, they can be working in the island from the mainland, they get to maybe 11 o'clock. and they have to wake up maybe by 3.
Noise deprives me of good sleep. Two is conducive. If the environment is not conducive enough, ventilation. If I don't have good ventilation, yes, my sleep is not going to be sound.
Welcome back. If you have just joined us, you're on to your regular program, The Physician, where your health is our business. We actually have been talking about sleep health and sleep to live. And in the studio, we have Dr. Chinasa Amadi. She is a board-certified lifestyle medicine physician and the founder of ARIELLA Health and Fitness. She's been doing justice to this particular topic, telling us that the number of hours that is actually required is 7 to 9 hours. That is what is the standard that before we can say you've had adequate sleep. And before we went on break, she told us about how sleep is actually a factor. If you do not sleep well, it's a factor that affects the social relationships. So, Dr. ARIELLA, Dr. Amadi, do you want to just tell us more about that? I'm very interested. How does sleep affect social relationships?
Now, first of all, when you don't sleep well, it affects your mood. You wake up cranky. And literally, you find fault in every little thing. It starts from the moment you step out of your sleeping space. So that will affect how people, if people always know that, hey, you're cranky, this person is always cranky in the morning, always literally, they will be automatically turned off. It automatically affects how people perceive you. It affects even people that should be nice to you, will not be nice to you because of what you are emitting. And that can just come from poor sleep. So it affects your mood. You can even stay moody till midday before you get your mojo back, yeah? And that affects if you work in an office with a group of people. They already know that, hey, this person don't even talk, yeah? So that affects your social relationship. It makes you will just want to fight on traffic, because first of all, you didn't get enough sleep, then you're getting on traffic, and you're so upset, literally, you know. So that affects that social component. Of course, we know that the social component is also part of health. It's a very integral part of health.
Very important.
Yes.
Then, do you have some disease conditions that can make people not sleep?
Oh,
Sleep
yes,
disorders?
of course. There are certain maybe thyroid conditions that could cause that. Yes, and also, you know, there's maybe some sort of genetic condition. But of course, we always say if there's anything, you have to, of course, work with the doctor, work with your specialist, and once the condition is managed, so that you get to sleep.
Okay, now you've told us about the consequences of not having adequate sleep. So do you want to just talk about the benefits if you sleep well? What are the benefits? Of course, it would not be the other way.
It would be the opposite, yes. Improved mood, improved productivity, improved health, your overall health, you know, and then of course it will also help with if you don't gain weight excessively, and of course it will also help with managing your blood pressure, managing your blood sugar, you know, just you.
It's funny enough, people say that those that sleep a lot gain weight. Because it's like a sedentary kind of lifestyle. Now, so too much sleep, they will tell you are sleeping too much, that's why you're adding so much weight.
When you don't sleep, yes, the hormone ghrelin is produced more. Now that is an appetite, it's like a hunger hormone. Okay. So you tend to eat more. And most of the time, you're not eating cucumber. You're eating other things that is not cucumber or garden eggs, of course, you know. So that's what happens when you don't sleep. However, when you sleep, you're getting the adequate amount of sleep. What is secreted most is the hormone leptin, which is the satiety hormone. So you tend to feel fuller, you know, faster. So you're not hungry unless you have natural longer throat. That one is a different issue. Okay. Yes, but then generally, when you sleep well, you tend to eat less. Okay.
So now that takes me to another question. For some people, when they take there are particular things that they take that impedes their sleeping early. Not caffeine. I'm not talking about caffeine. Some like chocolates. There was a guest came once and said when you take chocolate, something that has to do with sugar, it makes you more active and you don't sleep. Are there other foods that you want to tell people that at night it's good to avoid this if you know you want to sleep early?
One, of course, heavy carbohydrate meals, and of course, sugar meals. You know, I always say we grew up eating a lot of large amount of swallow. And we don't realize how that actually affects. Because your body is trying to, break that down, and you're trying to send it to sleep. It's just contradictory. Yeah. So of course, if you want to get quality sleep, one thing is to move your heavy meals earlier in the day, and of course, processed meals, move them earlier in the day. Sugar meals. You see, I tell people they think, look at what sugar does to children. That will tell you what it does to adults, but the adult doesn't want to be running up and down. When you give a child sugar, the child is literally wants to climb everywhere. That is the same kind of feeling that wants to happen in the adult, but the adult cannot be climbing everywhere. Do you understand?
Yeah.
So that will tell you what sugar does to your body when you're trying to sleep. So it's, of course, not a best option at that time. However, it's important to know that the sugar from fruits, which is from whole natural fruits, are different.
Okay.
Yes.
So what are the tips? The tips to improve
Sleep health.
What are the tips?
Tips to improve sleep. Now,
Because for instance, once somebody did say, that somebody actually told a patient that if you have a sleep disorder or challenge, you're unable to sleep, what you can also do is ensure that your bed is for sleeping alone and not on. So you are the professional. What are the tips that you have?
we always say keep the bedroom for sleep and sex. Yeah, that's what we usually say. So it's important. Most people take work into the bedroom. Once you take work into the bedroom, it automatically, there is that conditioning that it seems like, hey, I'm supposed to be working. Another thing is, if you shouldn't have a television in your bedroom.
Seriously?
Yes, I always say that is not luxury. That is just a sign of impending doom, literally. It is not luxury at all. Having a television in the bedroom is not a sign of luxury.
Because you think people will always want to watch the listen.
Will they keep television?
Movies?
Will they keep the television for unless it's a decorative tool, it doesn't come on. Unless that, which I'm sure it's
Not.
because what happens is the rays from the television, it actually inhibits the sleep hormone. So most people are saying, "Oh, I like to watch TV and fall asleep."
Yeah.
No, you're actually not getting the rested sleep. I always tell them, compare it with when you do not watch TV and fall asleep. And ask yourself, in all honesty, how do you feel in the morning? The difference is clear.
Okay, what if you have the television in the room and you've conditioned yourself that you sleep at 10? You're watching a movie, you're listening to the news, then at 5 minutes to 10 you turn off the TV.
It's best to turn off 60 minutes before. 60 minutes before
because
sleep
of the
time.
lights?
Yes, 60 minutes before sleep time, turn off all laptops, phone, television, so your body starts conditioning for sleep.
Okay, go ahead. Tell us more of the tips.
Other things that you can also do is, of course, to avoid, we've talked about avoiding heavy meals, avoiding sugary meals, and making sure your room is airy. If you need to leave the windows open just so that it is cool and you can, get in rested sleep, that's also good. Stay away from caffeine at least 6 hours before bedtime because caffeine has pretty much a half-life of 6 hours in your body. So even if you take it at 4 o'clock, caffeine, yes. Okay. So if you're taking it at 4 o'clock and you're planning to sleep at 9, it's still there in your body and it can also inhibit. Even though some people say, "No, I can take coffee and sleep." The quality is different. It's not just about the duration; it's also about the quality of sleep. Okay. So that also impedes. That also reducing your caffeine intake before bedtime or 6 hours before bedtime improves your sleep quality.
Okay.
Yes. So other things are, of course, we say taking out work away from the room. If you wake up to use the loo and just come back and sleep. Whether the sleep comes or not. Some people say, "Oh, at that moment I want to start praying," and I'm like, if you have a sleep disorder, you need to, of course, if you're not getting up to 4 or 5 hours, you have a sleep disorder. Some people say it's not my portion, but it's actually you have a sleep disorder. So you need to come back and just lie down and sleep. So if once you get into activity, your body seems like, oh, it's time to wake up.
Okay, so let me just ask you one thing. For people that I've had some patients, they don't sleep more than 2 hours. No matter how. They just sleep and they wake up. And even with that 2 hours, they still hear things around, okay? I think they need to see the professional when it comes to that.
Yes, and they need to be ready, because we say we have this culture. We have this culture around sleep where, oh, I cannot sleep more than 3 hours. Nothing will happen. Have you done everything? That is the question. Okay. Have you reduced your meals? Or you're eating fufu that is the size of a baby's head 2 minutes before you sleep, and then you fall asleep in front of the TV, and then you now take coffee, all those things. Okay. Yeah, so do all those things first and see if the sleep doesn't improve.
Okay.
The question is, are we willing to even do those things?
Okay. Before you leave, maybe the words of advice, especially to our teenagers, the youth out there that probably will read all through the night and go straight to the exam hall. What do you think is the impact, the effect when they do that?
Oh, sleep is very important for your memory. It's very important for clarity, mental clarity. It's very important that you sleep so that you increase your memory retention is optimum. So sleep to remember better. They told you don't sleep and then go into exam hall. They were wrong, trust me.
Thank you very much, Dr. Chinasa Amadi. It's always a pleasure having you as a guest, talking about this kind of health, giving us tips all the time. And I'm sure our viewers out there have benefited a great deal from all that you have said. Well, on this note, I want to say thank you for keeping a date with us again on your regular program, The Physicians. Remember to follow us on our social media handles, on Facebook, on Instagram, and YouTube. Our website is running. You can actually send us, go to the website. There's a questionnaire there. Fill the form. If you want to be part of this program, just fill the form. And we'll respond so that you can be part of us here. So stay tuned again. Stay with us again till next week. My name is Dr. Martina Agbere. Stay blessed.
My name is Dr. Oluwakem Yodukoya. I am an Associate Professor of Public Health at the College of Medicine, University of Lagos, and a consultant public health physician. And we're on The Physicians. Please follow them on their social media handles. And remember, there are 20 million Nigerians who are living with hepatitis B. You might be one of them. You might want to get yourself tested and possibly treated. Thank you.